Słyszę, widzę się, więc powinno być w porządku. Hello
Hello,
and
greetings from
welcome
Wrocław.
to second session of the International Pain Management Day held by Metro Cryoflex. My name is, and I'll be hosting this meeting. This meeting is going to be a little bit different than the previous. It's going to be very, very specific. We will deal with one of the areas cryoanalgeisa implement Poland and all over the world. I mean, and cardiac surgeries, uh, but in a very specific group of patients. Who we are gonna deal with today are children. So uh, very specific and very uh, important part of our patients. Before I introduce the panelists, the doctors whom I personally know because we are based in the same hometown, which is Wrocław, Poland, um, I'm gonna say why cryoanalgesia in the group of children patients is so important because um, I think the thoracic and cardiac strokes are painful because we are dealing with children. We need to prepare some really effective analgesic uh, approaches operationally. And guests say Dr. are actually specialists on that field. Dr. Anna Tomkowiak is a cardiac surgeon operating but also adults, and Dr. Piotr Dryański is a children's surgeon interested in thoracic surgery, but also urology. Uh, let's cut to the chase and let me ask you the first question, doctors. Let's start with the lady, please, Dr. Anna.
Hello,
Can,
nice
can
to
you
see
can you
you.
please tell us? Yeah, hi, hello. Can you please tell us why that post-operative pain management uh, in pediatric cardiac surgery is particularly challenging for you, operators, doctors?
Hello. It is really good question because if we are talking about the pediatric surgery, it's quite difficult. We've got two accesses. The first one is the sternotomy, so through the sternum, and the second one is from the thoracotomy. So if we are talking about the pain procedure after the surgeries, we have to think about both of them. So the sternotomy is less painful, but thoracotomy is really painful for children to cope with. So that's why I think that cryoanalgesia is one of the points that can help with long-lasting pain during the surgery. And we've got really good protocols if we are talking about the medicaments, all the infusions. We are using nalpain, we are using paracetamol, so it is really good protocol to use in children. But children are not talking about the pain as because we've got the children from the couple of the child has a couple of days after birth, and we've got adults like 18 years old children. So it is difficult to cope with really young children because we are looking and we are searching how they react. So this is the only thing that we can cope with the pain. So we are putting some analgesic painkillers, or we are using another type of pain treatment. But if we are talking about the cryoanalgesia, it is really a good way to cope, especially with the thoracotomies, but not sternotomies. We are not using them in sternal access, but only in thoracotomies. Thank you.
Anna, thank you very much. Piotr, can you answer the same question, but from a thoracic point of view?
Yes, yes. Thank you for having us today. My point of view is slightly different because we are not using cryoanalgesia for open surgeries, but for my expertise is connected with pectus excavatum, but minimal invasive repair, so with MIRP surgeries, and that's a little bit different. The access is not wide, it's not big. But there are several overlapping reasons why the pain management is challenging. First of all, the pain intensity and mechanism, because as we must say, the MIRPE procedure creates large sustained mechanical stress on chest wall. That's why even if the surgery itself is minimal invasive by the name, we do create a lot of pain for the patient, not in the incision size. That's why the cryoanalgesia became crucial. We started using it at the December 2022. So we've got like 3 years of expertise, and we see a lot good of use of it. The next one was said that the children process pain differently. They especially adolescents, because our surgeries are for the teenagers. They oftenly underreport the pain. They tolerate higher pain, and that is a factor complicating assessment of pain in those children. The next one, we have to think about the parent that is involved in the treatment of the child, because they have slightly different goals. The parents and the patient itself. The patient wants to be quickly mobilized, quickly moved to school, to sports, and the parents are concerned about the safety of the procedures, about the safety and of the pain management. Then the next one that is crucial is system variabilities, because unless Dr. Tomkowiak said, we do not have one specific protocol. Every center uses different means. There is a plethora of methods used, including epidurals, including PCA pumps with oxycodone, nerve blocks, and there is cryoneurolysis, of course. So every center uses mixed options of the ones I said, and that's why the pain management could be a little bit tricky in children.
From what you just said, Peter, I would guess the outcome that cryoanalgesia was kind of a changer for you. Is that correct?
Yes, it was a game changer, because what I remember from the before cryo era, let's say so, are the teenagers laying on their beds for days, and now it's like because we use the cryoanalgesia surgically, intrathoracically. Yes, so during the surgery we just treat the intercostal nerves with this low temperature. And what we see after the usage is a really big drop of length of stay of those patients.
In your hospital, Dr. Tomkowiak, can we say that it really shortened the period of time spent in hospital in your case?
I understand your way of thinking. Yes, thank you. But in our specialty, it's a bit different because uh, we've got complex diseases because we are cooperating with the heart. That's why we've got heart insufficiency. So we need to the length of the hospitalization is the same, but we use less painkillers for the children. They are really better. They are better mobilized, and they are getting better to normal functioning, to normal function. So this is the most important thing for the children and for the parents. So they see that the child can be really quickly put on their feet to get out of the bed and function normally. So for us, is the most important thing. But uh, we've got another specific. We cannot shorten the stay in a hospital due to the other morbidities, and we are cooperating with the other organs here. So that's why it's a bit
Sure, yeah.
different.
I just did phrase the question incorrectly, but I know what you mean, and of course I agree with it. Okay, doctors, to end our session, I'd like you both to think about a very significant example of recovery that was actually very quick. If you can think of any patient like this, Dr. Piotr, could you share the story with us?
Well, there's no significant one patient. It's rather the group that we should talk about because, well, I have two of them. Those were twins, boys and 17 years of age, treated for pectus excavatum, and they left the hospital like the second day after the surgery. So it's well, for those who are acknowledged with pectus excavatum surgeries some years ago, they were really laying down in their beds, and those two boys just after the surgery the next day they stood up, and it was like, okay, I can go home. So those are like that bright moments. But what I wanted to say, as we should think about the group itself, is some data that I compared for our clinic. So before and after the cryoanalgesia. So before the surgery was a little bit shorter, but the stay in a hospital stay was 3-4 days longer, just because of the pain. Not talking about the opioids usage, not talking about the additional drugs needed. So just the stay was shortened up to 3 days just because of the cryoanalgesia. So that's better for me. It's better to think about a specific group of patients, not just a single one.
Thank you very much. And Anna, I know you are preparing some data. You're collecting data about patients with cryo. Okay, can you please share your expertise with us?
So maybe the first thing I will talk about the case, because the first question was about the case, because I've got really great one. So lately we had the girl after the ring procedure. So it was we are talking about the thoracotomy, and she was about 5. She was really small one, and we omitted the cryoanalgesia. But after that, because those we are having a drainage 2 days, and after that we are taking it out. So for a child, it's quite good. So we don't need it. But helothorax appeared, and we were treating her with the anti-inflammatory stuff, with low fat diet, and the helothorax was quite long. So we took her on the table to close the thoracic, all those ducts that was making a problem with the helothorax. And I made her a cryoanalgesia. Before that, we had a really huge problem with small depression as the first thing, the pain. I was making her a block, intercostal space, block of the intercostal space. She was vomiting, and after the cryoanalgesia, she was really smiling, normal functioning girl that she was walking with the drainage, and it was really a huge relief of the pain. So this was really great case to show this method and this kind of analgesia is really excellent for the children. We are a bit scared with children which are really low, because we do not know exactly how is the radiant of the temperature, how deep it gets into the tissue. If we are talking about the
Okay.
small children, uh, we are not sure, but we can shorten the time of cryoanalgesia is the first thing. And if we are talking about the patients, then I am doing a mid caps. So this is mini invasive, one vessel or two vessels, because I'm starting with the two vessels, revascularization of the adult patients. And for the adult patients, the thoracotomy, even if it's small, the tension in if I am retracting the intercostal space, is really painful for the patients. We were making all the interspinal blocks between the intercostal space blocks, but they didn't react as good as they should. So we started with the cryoanalgesia, and I think that right now we've got about 100 cases of patients that were dealt with cryoanalgesia. And lately we were calling them after a couple of months and after a couple of months, and most reaction of the follow back and the feedback from those patients, that the pain was really not so visible for them, and the functioning we can see when they are rehabilitating on our ward. So they can do it faster. They can work with the breath. So they are really in a good condition, in a better condition. They don't have problems with the um, with the lung compression. Yes, thank you. Sorry, I'm at home and I've got my cat here.
You've got a very pretty cat. Yeah, that's right.
Thank you.
Look, Peter, kind of a similar question to you, because I know you do the regular checkups upon your patients that were released home. Could you tell us how long the block made by freezing lasts? Let's say, what's the median?
Okay, the
Time.
median should be somewhere about 6 months, because that's the time when the chest will, well, what we're dealing with. We do the cryoanalgesia because of the change of the architecture of the chest wall, yes, and it takes time for the nerves to adapt to this new situation. The cryoanalgesia gives us up to 6 months of flawless pain management. And that's perfect. That's just enough for the patients. As Dr. Tomkowiak said, the checkup is really crucial. So we do have those visits, like first up to two weeks after the surgery to remove stitches, then 6 weeks later, 3 months later, six months later, and so on. So we do have the information, and there is a place for parents, especially to check some concerns about, for example, some loss of feeling that happens, and it continues up to 4 or 5 months normally.
Yes.
Yeah. Do you agree, Anna?
Yes, I agree. Yeah, I fully agree with this, with your opinion. I observe the same.
So, to sum things up, can we say that cryoanalgesia is a very effective way pain management, of post-operative pain management, and uh, kind of ease it eased the patient's recovery after your procedures. Do you both agree with that, or do you have any other experience with
I think that in most cases, if we are talking about the thoracotomy, uh, my experience, because thoracotomy is the most common way. If we are talking about the cryoanalgesia, I think it's a really great way to cope with pain and to reduce the pain, so children can normally rehabilitate themselves, and we can work without pain. Okay, the feeling of we cannot feel the skin, or we have some problems with the feeling, but I think it's not a bad way. It will come back with the time. So for children, I think it's not a bad way. So it's a great way to cope with the pain.
Thanks. Peter, do you
Well, in my
confirm?
opinion, in my opinion, the cryoneurolysis is like a crucial additional method. So without it, the pain management for me would be incomplete because it's not
Yes.
well, we cannot compare one to another. It's not like opioids versus cryoanalgesia. It's opioids plus cryoanalgesia or opioids without them. This is the thing we should compare. And the for me, like from those 3 years of expertise, the cryoanalgesia is a must-have.
All
I
right.
don't
I will add
see
something,
possibility to.
because you said that opioids. Um, I noticed that we use less doses of opioids, or even we do not use them at all. So
Okay,
it's a really good
that's what I
way.
said before. Like those different algorithm of pain management. We are working on some of our own. So maybe we will be able to get rid of opioids at all. I hope so.
Yes.
It would be perfect. But what I meant, like generally, is that I don't see a possibility to perform MIRP surgeries now without the cryoanalgesia. It's like
Yes.
must have, as I said.
And
Thank
I
you
would
very
like
very
to
much.
add that we do not observe any allodynias.
Mhm.
Which is quite important,
Yes.
isn't it? Thank you. Thank you very very much. It was a night. It was a pleasure meeting with you, and I hope the event called the International Pain Management Day, held by Metrum, will become an annual thing. So let's hope we'll meet again next year and the following years. Thank you very very much. Thank you, listeners, for having us, and let's get ready for the next panel. Thank you very, very much.
Thank you very much. It was a
Thank you.
pleasure.